Hello, I'm Callum Campbell and I am Chief Executive of NHS Lanarkshire. I joined the Health Board in January of this year and I look forward to working with you all in the forthcoming years. On arriving in NHS Lanarkshire, I was very aware of the challenges that the GP out of hours service had. I can assure you that these challenges are no different to the challenges faced by every other health board in NHS Scotland. I am impressed with NHS Lanarkshire's response to these problems. I would like to thank the public and other partners who have worked with us in considering this and coming forward with this consultation document on how we believe these challenges are best addressed. Both I and the NHS Lanarkshire Board fully endorse this process. We are very keen to hear everything you have to say, and I can give you a personal assurance, as well as an assurance on behalf of the Board, that all comments will be given due consideration and will be considered as part of the process the Board will go through before a final recommendation is made to us in May of this year. Thank you for taking your time to participate in this, and I look forward to hearing from you.
I'm Craig Cunningham. I am the head of South Lanarkshire Community Health Partnership, and as part of my role I've also been heading up the review board, which has been looking at reviewing the service over the last almost 18 months. Unfortunately, given the reducing number of general practitioners who are available to work in the out of hours period, it has not been possible for us to be able to provide that level of reliance that we would otherwise wish to do. This is not unique to NHS Lanarkshire, and in fact is an issue that has been experienced across the country.
Hi, I'm Lorraine Smith. I'm the Service Manager for the out of hours service. I have a background in nursing, from nursing and health visiting and in public health nursing. Primary care out of hours service is provided across Lanarkshire, and it has been provided since 2004, since the change of the GP contract. The primary care out of hours service is to provide care to patients in Lanarkshire who need urgent medical care when their GP surgery is closed. The biggest issue that I've had to deal with over the last 2 years is having enough staff, GPs and nurses, to provide a safe level of service in the out of hours period. Often we've had to put in place plans where we reduce from 5 centres to sometimes 4, 3, 2 and on the odd occasion 1 site. This is to ensure that patients can be seen in a timely manner and an efficient manner, and that the clinicians who are working in the service feel supported. Of the doctors who work in the service, some are employed by NHS Lanarkshire, known as salaried doctors. The vast majority are doctors who are GPs during the day who take on extra work in the evening, weekends and on public holidays. It is reassuring to all staff to know through the work that has been done with the review that patients that do access the out of hours centres and or home visits feel they get a very good standard of care. However, it has become increasingly difficult to get enough clinical staff to cover the centres and sessions that we need to cover.
The current model of service delivery for out of hours care in Lanarkshire is not sustainable. This is partly due to the relative low numbers of GPs available to do sessions and shifts within the out of hours service. It is therefore necessary to consolidate services at either 1 or 2 sites for seeing patients in the out of hours period. It is important to note, however, that the home visit service for housebound and disabled patients will remain unaffected. The public consultation phase is designed to ensure that the best model is chosen for future care provision in the out of hours service in NHS Lanarkshire.
As the Associate Nurse Director for the out of hours service, I can guarantee that we will provide safe effective person-centred care from the staff who are caring for the patients of NHS Lanarkshire.
Hello, I'm Colin Angus. I'm an unpaid volunteer, a member of a public partnership forum in partnership with NHS Lanarkshire. I've been involved with the primary care out of hours review process for the last 15 or so months. I was a member, and still am a member, of the review board and a member of the communication and engagement group. From the very start, I feel that I, as a member of the public, have been totally involved in the process to date. As part of the communication and engagement group, I was involved in the design and format of the questionnaire. And in fact, I was insistent that one of the questions that I felt was a big issue for the public was included within that questionnaire. At the development stage of the option appraisal event that was held at Wishaw General Hospital, again I felt I was fully involved and engaged in the process. I was given an ear, I was given a voice, and I actually put forward one of the options at that stage.
Basically, I've been actively involved in the process from the beginning, being a member of the review board and the communications and engagement group. I've also been part of the equality and diversity impact assessment to ensure that we're including all excluded groups like ethnic minorities and gender groups and disabilities. From a carer's point of view, I've been able to put in some questions into the questionnaire that went out to the centres.
I've worked in the out-of-hours service since 2006 and have seen a big change in workload over the past 8 years. I've worked in all of the centres across Lanarkshire. I think the challenges in the service are multifactorial. At the moment we do have a deficit of doctors wanting to work in the service. So a great deal of time is wasted at beginning and end of shifts, setting up accommodation and then dismantling all the equipment at the end of a shift. I think the ideal circumstance for GPs working in the out-of-hours service is to be part of a multidisciplinary team with other members of staff available. From my perspective as a GP, moving to a purpose-built health centre accommodation will be a huge step in the right direction for the out-of-hours service. I have been aware of the out-of-hours review service and have also been given the opportunity to contribute to meetings about the review.
My name's Jackie Blackburn. I've been a nurse practitioner in the out-of-hours service in Lanarkshire for the last 10 years. Really from the outset, it has been a very challenging job and it's been a huge learning curve for the nurses. Over the years, I suppose there's been challenges in that we don't have an awful lot of staff now to cover all of the service within Lanarkshire. And I have been involved in a small part with the review process. I think it can only be for the better. At the minute we're struggling with covering centres throughout Lanarkshire, and at times 2 or 3 centres can be closed. It will mean that staff will not be working in isolation and it will be more of a team and hopefully more members of staff.
My name's Lynn MacDonald. I work for the out-of-hours service. I do an admin role, a hub dispatcher role and a reception role. Okay, in particular, over the really busy periods, some of the challenges are we don't have enough GPs and that puts pressure on the GPs that are working for the service.
In order to find the best possible locations for the future provision of NHS Lanarkshire out-of-hours service, a number of locations across Lanarkshire have been explored. Following a thorough planning process, including developing an accommodation specification for the out-of-hours service, intensive workforce planning and analysis, setting out population numbers by locality, and including rurality and deprivation, a full analysis for each of the locations has been undertaken. It's worthy of note that the workforce analysis demonstrated that NHS Lanarkshire has consistently available sufficient GPs to provide no more than 2 or 1 primary care out-of-hours centre. Using Lanarkshire postcodes, maps were produced for every single model and for each of the locations. These were completed on behalf of NHS Lanarkshire by the Scottish Government Geographic Information, Science and Analysis team. Locations and combinations were mapped to determine the population flow within Lanarkshire. This was in order to give us accurate driving times from every area in Lanarkshire to each of the locations proposed. A stakeholder engagement event was held in November 2014. Drawing on all available information from the stakeholder event, a recommendation was reached through a robust scoring process. The 2 high scoring models to be set out for the public consultation are 1 primary care out-of-hours centre at Douglas Street Clinic in Hamilton, or 2 primary care out-of-hours centres, 1 in North Lanarkshire, 1 in South Lanarkshire. These would be based at Douglas Street in Hamilton and Airdrie Health Centre, both within community health centres.
As manager of this service, I fully support the proposals we've been asked to consult on. Currently the service is under great pressure, and that pressure is felt by all the staff trying to provide the service to patients. I feel if we can come together, work together, then we will provide a better, safer, more efficient service to all the patients who access the out-of-hours service.
My name is Jim Halliday, and I've been with the out-of-hours service for 5 years. Working at various locations. It's quite a demanding role due to the fact that a lot of the times there are time constraints placed upon us to get for different locations, and this is the vast area that we cover, from almost down at the borders up to Glasgow city boundary, and at times it can be quite demanding. I'm aware of the review taking place. I think it will streamline it and make it more viable, and hopefully allow us to see patients quickly and in a more efficient manner.